Let's take a look at Martha Stewart and see if she's had any potential facial plastic surgeries. Stay tuned for the cost of the potential facial plastic procedures and a side-by-side comparison at the end. Martha Stewart has said, "When you're through changing, you're through." And in a recent People magazine, she also said, "I've had absolutely no plastic surgery whatsoever." Let's see if we can reconcile these statements. In 1959, at the age of 18, Martha has infrabrow fullness and some upper eyelid hooding. She also appears to have a thinner upper lip and a nice strong jawline. Now let's fast forward 30 years. It's now 1989 and Martha is 48 years old. And what you can see here, before the days of cosmetic Botox, people had rhytids or lines on their face. So you can see here the crow's feet appear to have some lines, and that's very normal, especially for someone who's 48. In 1990, at the age of 49, Martha is showing some signs of aging. She has lateral brow droop. The lateral aspects of her eyebrows are starting to fall. She has philtrum lengthening, so the area between the base of her nose and the upper lip is starting to get longer. And she also has ears and nasal lengthening, which is very normal as we age. The skin tends to expand and our ears and our nose tend to get longer as well. Her lower face is also gradually dropping. You can see some early signs of jowling at this point. In 1991, at the age of 50, Martha has maintained excellent skin care, and that contributes to a youthfulness. But I'm not seeing any changes, and this is the same through 1999. In the year 2000, at the age of 59, I think Martha may have started getting cheek fillers around this time. You can see some added fullness in her medial and her lateral cheeks. Cheek filler that's placed laterally on the sides of the cheeks here is usually placed down onto periosteum or the actual bone. As you get more medial, usually you lift off of the bone to inject the filler, and the filler tends to be a higher G' consistency or higher viscosity so that you can get that more of a lifted type of look. In 2001, at the age of 60, I see no changes, and that's the same through 2005. In 2006, at the age of 65, I see the introduction of potential Botox. But despite the potential introduction of Botox, there are still some lines that are going to be more difficult to correct since they've been present for a while. So you can see the crow's feet lines are still very much there, and there are still some signs of the glabellar lines that are going to be more difficult to eliminate because they're more etched in from the aging process. In 2007, at the age of 66, I see no change, and that's the same through 2019. In 2020, at the age of 79, I am seeing some changes here. And let's remember that this was the time of COVID, and there was definitely a boom in plastic surgery, but also people getting non-surgical procedures as they spend more time looking at themselves during Zoom calls or just in the mirror at home. So this was a time when we started to see an increase in popularity of different types of facial aesthetic procedures. So this may be the reason why Martha decided to pursue some procedures around that time. I'm seeing some signs of a brow lift plus or minus an upper blepharoplasty. Keep in mind that blepharoplasty procedures as well as brow lifting isn't always done for cosmetic purposes. Sometimes there's a functional reason for it, in the sense that sometimes the upper eyelids and the brows, as they sag, it can actually obstruct our vision to a degree. Visual field testing can be performed to figure out if there is a problem with the way that you're seeing because of some of this extra skin that's hanging down. And if that's the case, usually insurance will actually pay for these procedures in order to correct that type of deficit. Now, that might be something that Martha was experiencing at the time, or it might not be. I'm not sure, but that is something that many patients experience. But you can see now that she has more of a supratarsal show, so that area on the lower part of her upper eyelid is now more visible compared to prior. Brow lifts that are performed later in life are not meant to create that type of fox eye look. they're pretty much trying to reestablish the original anatomy, or something closer to the original when the person was, say, 30 years old. When patients are 30 and they're trying to get a brow lift to look even more exotic and extravagant, then they're getting pulled to the point of giving the appearance of that type of fox eye. Even if the surgery itself is the same, the result looks very different. In 2021, at the age of 80, it looks to me like Martha started to get some lip filler around this time. But this was being done in a very subtle and tasteful way. You're not seeing that type of distortion like some people get, but I think it looks youthful and rejuvenating on Martha, and I think that it was a job well done. Now, in talking about lip filler, you generally want to use a thinner type of HA filler, something that isn't as thick and unnatural looking, and something that will work well with the natural movements of the mouth. In 2022, at the age of 81, I see no change. And in recent images in 2023, still at 81, what I'm seeing here is that Martha may have had a deep plane facelift. The submental platysmal bands that she had seem to be significantly improved. And from the prior brow lift that she may have had, what you can see here is that the lateral brow and the medial brow height position is now the same, as opposed to what it was before, where the lateral element of the brow was starting to droop lower than the medial element of the brow. And in May of 2023, Martha was featured on the cover of Sports Illustrated. And what I'm noticing here is that there is a change to the right tragus, and that portion of the ear is very commonly modified with a facelift. And the reason is because most surgeons use a tragal or post-tragal incision in order for there not to be any obvious scarring in front of the tragus, but as you make the incision behind or right on the tragus, you're pulling that skin over it, and so you lose some of the natural crease that exists right in front of the tragus. With a deep plane facelift surgery, the average amount of volume that's added to the lateral cheeks is about 3 cc's, and you can see that enhancement in Martha's appearance as well. Her jawline is also much cleaner. There are little to no signs of residual jowling. And it's possible that Martha may have also had earlobe reduction surgery that is often combined with aging face surgery such as facelifts in order to reduce that lengthening that we talked about previously. So a portion of the lower earlobe is actually removed and resutured in order for the ear to look shorter. And just a reminder that plastic surgery has no age limit. What matters more is one's general health to be able to undergo the procedure, and of course to be able to maintain realistic expectations throughout the process. The total cost of these potential facial plastic surgery procedures is $290,000. And here's a side-by-side comparison. Since you like this video on Martha Stewart, check out our video on Jennifer Lopez's potential facial plastic surgery procedures.